My name is Mehdi. I am a GP. I start my work in a public system in Melbourne. I was a HMO at Dandenong Hospital and then Sunshine Hospital. When I was in Sunshine Hospital, they sent me for a rotation for the pediatrics to Mildura Base Hospital. And at that time, when I come here, I met people around and I liked the area. Then, when I went back to Melbourne to finish my hospital training, I told Izzy, look, I think it's a good place to go. Let's go and try Mildura.
My name is Izzy. I'm originally from Turkey. We decided to migrate to Australia 14 years ago under the Skilled Immigration Program. I'm the practice manager for San Asia Medical Center. However, originally I'm a civil engineer and I worked as a civil engineer for 18 years, but just done a sea change.
So we came here for me to start my GP training in 2008. And first we came for 6 months, and then after that we extended for 2 years, and then it went on until we decided, no, we are going to stay here, and also maybe to extend the services that we are providing in this area with my own perspective. So I look around and decided that the best area that is probably short of services and would benefit most is Redcliffs, which is close to Mildura as well. And it's a beautiful town with a very welcoming people. And 2nd of January 2019, we opened our doors. And since day one, we were flat out with all the patients coming through. So we try to provide best service that we can to the region, not necessarily Redcliffs, but all the region around, including Mildura, and some people come from other close by towns. Now, when you look at the gap in the services in this area, you see it's not only GP services. This town didn't have a podiatrist, didn't have a diabetic educator, didn't have a dietitian. They had a physio who was long established. So we decided to fill all of these gaps. We are in the process of getting accredited with MCCC, which is the GP training provider for this region. And we are hoping to attract GP registrars from August next year. But the difference between the rural and the urban general practice is you should be a bit more procedural and you should have a better understanding of specialized services, because more often you need to manage patients and fill the gap between the GP and the specialist services. They are not always available. So you need to know a little bit more than what general GPs do in the cities. But it's not something scary. It's actually very rewarding, because then you start to feel that you are making the difference.
There's plenty of things to do actually. There's always a stigma in people's minds. There's not much things to do in country. There's a lot of nature walks that you can do. We're very lucky to have an airport in Mildura. So and Adelaide is just 4 hours driving. Yeah, there's national parks nearby. Hera Kalkan National Park. There's lakes, and we do a lot of nature trips with kids. Also, we do involve into a lot of community events as our background. So there's no sometimes time to sit at home on the weekends.
Yes,
Yeah,
most of the time,
most of the
quite
time
busy.
very busy, and yeah, it's I think like a stigma. I was like that because I came from a very busy living back in Turkey, and Medi as well. And we were thinking, oh my God, what does people do in the country? It looks like a dead town. It is not. It's really very busy.